Welcome to the office. All right, Danny, we're going to go over your x-rays now. This is your side profile. And on the side profile, we're looking for many things. We're looking, do we have the right curvature? And how is our posture? And the thing I noticed when we were taking your x-ray is you carry your head back quite a bit. And one of the main reasons you're here is this was, whatever happened, I believe, started, or may have been sooner, but definitely from that basketball injury where you fractured your left ankle, and it started, obviously you landed on your side, and things started to change for you, right? We have crackling, popping in the shoulders, more this one, a little bit on this one. We have instability in the ankles, and you're getting tired and fatigued, correct? Mm-hmm. Okay, and TMJ, we won't forget. Now, when we look at your posture, first thing we're looking at, do we have the right curves? 60 degree forward, some books say 40 degrees. Yours is straight, starting to go reverse, and we'll go closer into that. Your spine here, you don't have a lot of curve in your spine. So when you're walking, standing long time, I know it feels uncomfortable. Second thing is, when we look at your posture, this is the low back or where the hips line up. It should bisect, go through here and here. And what it's showing us is you carry your upper body behind your foundation. So I know your shoulders get tired, they get tight when you're sitting or standing a long time. Mm-hmm. Make sense? Mm-hmm. Okay. Now, and we're going to go in more detail here on these discs, but overall your discs look good. I'm happy with them so far. And we'll go in more detail there. Let's go into your foundation and see what's going on. In order to have a stable building, we need to have a level base and foundation. You were talking about the left scapular or the left shoulder, and I'll explain the mechanics of why it does that. Okay? Let's first look at your foundation and see. Now, we can see there's some tilting or some curvature in the spine. It's not a lot, and it's okay. That my business isn't here to try to straighten a spine. My business is, do we have a level base and foundation? Do we have the right curves, and are all the joints in the right alignment as they should be? We're going to talk about your digestion a little bit too. So let's go first at the foundation and see. First thing is, do we have a level base and foundation? And what I want you to notice is this. You see this obturator, this hole is smaller, this hole is bigger, right? Mm-hmm. This is the pubic bone, this is the crease of the bum here. And what's happening is your pelvis is going to your left side. So when you walk, if you walk on her right side, you bump her. Mm-hmm. Okay? Does that make sense? And we're slightly favoring that left. When I go closer into your SI joints, you can see there definitely was that trauma, that whether it was that particular basketball injury, probably, or something else, you have a lot of scar tissue in this SI joint. This thing's not moving. This thing you can see nice through the, you see this line here? Mm-hmm. You can see through it, a little bit of scar tissue there, but you can see nice through the joint. Look at that. That's all white. That's calcium. So we got to see if we can get that moving for you. Okay? Does that make sense so far? Mm-hmm. All right. All right. Now, let's look at the numbers and see what the numbers tell us. If we go to the numbers, now this will make some sense. Okay. So there's two things going on here. Three things. We have a rotated sacrum on the left side. We have a rotated pelvis on the left side. The sacrum is dropped 3 millimeters on the left, and we have a slightly shorter leg on the left. So you favor this way. The good news is this. The measured difference right now is 3 millimeters, okay? If I fix the pelvis, it's going to go to probably about 5. Whatever that is, it's still under 7 millimeters. As long as the hip is under 7, the difference, it's fine. Adjustments will hold. But 3 of it is coming from the sacrum. That was your tailbone injury. That was the fall. You had more than one, though, I know. Mm-hmm. And the reason I know is this. This is calcified there, but you have rotated sacrum that dropped 3 and the pelvis. They wouldn't happen together usually. Let me show you what I mean. the left side, it goes back 2 and down 3. The pelvis goes down 1, but it turns in 7. Then the whole hip goes down on the left. That's the imbalance. Okay? Does that make sense?
Mm-hmm.
All right. Madam, make sense?
Yeah.
Okay. Now, let's continue back over here. Now, from that, we have a little bit, you can see a little curvature. But that curvature, as I said, it's coming from a couple of places. It's coming, one, from the foundation, and 2, from this L5 is tilted. The other thing I want us to look at is you're starting to get calcification of what's called the iliolumbar ligament. You have a ligament that connects here. They connect from the pelvis to the lumbars. And I'm starting to see right there, it's starting to calcify right there. So you're probably very stiff on your left side, I'm assuming. And so you've been favoring that right side. And then you said, I'm starting to feel it now on the right. You see this piece here. This is what I'm showing you. So it's trying to, this ligament is tight. It's trying to calcify. And it's probably because of the instability. Are you still playing basketball right now?
Mm-hmm.
Yes?
Yeah.
Okay. You're going to take at least a week off basketball. No, all I want you to do is walking, hiking. Pasadena has nice trails.
Mm-hmm.
Okay, walking, hiking, swimming. That's it, just for a week. Okay. Now, as we come up the spine, starts to level out. Discs are all good here. Now we have another situation right here. Number 1, number 2, number 3, 4, 5, 6. You can see 6 starts to tilt. 7 is good on 8. 6 starts to tilt to the left, and it's creating this here. And this area is the one that controls some of the stomach function, the digestion. Okay? As I go up the spine, it's coming this way to the left. Again, it's compensating. And now we're going to get to your jaw. When we look at the jaw, you can see from right, it goes down on the right side. It goes right to left. Okay? Follow my process for a second. It goes from right to left side. Now, we need to measure which one is thicker or which one is bigger. It doesn't mean it's physically bigger. This is an X-ray projection. It's telling me the compensation side. So your left side is the compensation. It's doing this. It's coming down from right, and then it's compensating on the left. So we'll figure that part out. But there's another piece of the puzzle here. And the piece of the puzzle is we have a wedge C2 on the left side. If you see, I posted a video of, there was a lady, and she had a long TMJ issue, long time. And we found it was coming from her upper cervical. So we have a C2 wedged on the right. You can see the atlas on the right is more swollen here on the right side than it is on the left side. Do you see that?
Mm-hmm.
So the question is this wearing out or is this swollen? We'll check it on you. But if we're going to work on the atlas, we have to first work on your C2. Okay? So far so good?
Mm-hmm.
All right. Now let's go to the side film and look and give you the good news. You have a tailbone injury here too, right there at the Coccyx to S5. Maybe that was from there, maybe that was from something else, but there's a tailbone injury there too, down low. We'll have to address, so there's 1, 2, 3, at least 3 falls on your tailbone, good ones. Here's the good news now. Your disc is good. Your discs are good. 5 is good, 4, 3, 2, 1. 12 and 11, a little wear, but they're great. These discs are all good. Discs are good. This one is wearing out a little bit faster, and so is this one. This is part of that kink in the other part of the spine. Now we get to the neck. The discs are good, but look at the angle of your atlas. And if I draw the line from the angle of your atlas here, okay, it's gone forward. So these lines should be parallel, okay? So this one is going up, you're carrying up. It's probably your C1, C2, we're going to have to figure that part out. Okay, I'm going to just take these out. Do you see what I'm showing you?
Mm-hmm.
So your C1 is, that's why you carry your head up like you're going to fall back. All right. You haven't been to a chiropractor before?
No.
Oh, well, I'm your first, huh? Okay. Let's go through your flexion extension of your neck. This is your neutral. This is your extension. This is flexion. The good news is this. These all move forward. Okay, so that's good. And this is going to be more posture related. And I just want to check one thing here. So these all move forward. There's no disruption in George's line. There's a little bit difference here at the C2, but it's not bad. I'm okay with that. This is going to be upper cervical foundation is where we're going to start. Penthouse in the basement. Okay. Any questions on the x-rays?
So far, okay.
Okay, let's get started. Now when we're looking at the shoulder, we're looking at the scapula, we're looking at the humerus. If the scapula, and I showed you there's that little kink going on here, this is what's throwing off the mechanics of his shoulder. The neurological control of the shoulder comes from here, the brachial plexus. C5, 6, 7, T1, T2, nerve supply to the shoulder and to the arm. But we have to look again at foundation. If our foundation isn't right, you can already see he's twisting right here. If we look at him here, he's twisting. So he goes like this, and then his whole body kind of twists. His pelvis wants to go left, his upper body wants to go to the right. Okay? Let's walk to the corner of the room and back, please, and let's see. Go ahead and walk for me. And you're going to do it 3 times. Just whatever your regular walk is. And you can see he kicks his right leg out when he walks. He swings the right leg. That's because of he's posting on his left, swinging out his right. Keep walking, please. Keep walking. Keep walking. One more time. Look straight ahead. You got the Shanghai swing, not the wiggle. Come over here and have a seat. Starting at the base of the neck. First thing we're getting. It's up top. That's up high, C1, maybe occiput. There we go. It's up top. Looks like we were going to get something at the base, but we're not. It's a little bit lower down. It's around T2. And this is also an old injury that he's been compensating on, so maybe we have a big hot inflamed nerve, maybe we don't. Right now, what's hurting you the most, Danny? Like you can still function and take care of your business and your children and everything, right? He's still, so that he's not acute. He's not like, I can't do this, I can't do that. T9, T10, left side, 5 points. That's the adrenal area. That's that energy fatigue. That's that waking up in the morning. That's the getting tired button. But remember, I can point all these things out. This is heart and lung. This is the upper cervical mechanism. But the reality is this. When we have nerve pressure anywhere in the spine, it can cause anything. Anything can cause anything. And the idea with what I do here is we're out of balance. We need to get back in balance. And it's all starting down low for sure. 11 points, S3, S4, down low. 1, 2, 3, 4 pressure readings we're getting on the meter. Let's go ahead and feel the pelvis first. Scoot forward a little bit, please. Feet together. Open and close your knees with your feet touching. Open and close. Open and close. Open and close. Good. Right side only. does the right, the left wants to shift with it. And it's tight, all of this is tight. You can see the erector, all of this is activated compared to his right side, his left erector. This is tight. Not tight, it's stiff. Okay, do the left side only. Yeah, when he does the left, the right side is fine. So we have a left SI joint. Let's go ahead and statically palpate, head down please. When we're looking at his body here, we can see overall he's red just from the scoping. This is all inflammation. This is all inflammation. Alright, you can see all of this right here, it's swollen. 1, 2. Tender there, yes? Pain? Yeah. Pain? Yeah. Not as bad, but hurts. Starts here. 3, 2, 1, 2, 3, 4, 5, 6, 7, 8, 9. Round your back. Go forward, no, forward. More here,
No, it's okay.
or this one.
Yeah, it's okay.
Okay. We'll wait on that. Same thing here in the tailbone. Relax the body, Danny. Relax the body. Relax the body. So we have T2 and T3. If both are hot, we're going to obviously start on the lower one, T3. This is S1, tender. S2, more tender. S3, now you can see his face. S4, yes?
Oh.
S5,
Oh.
oh, we down low in the basement. We're in the freezer room. We're down in S5. So this is, I'm going to go down to that coccyx. Yes? Coccyx to S5. And all of it is tender from there. We have an IN ilium, we have a coccyx, we have an S4, S5, we have T3. Sit back for me, please. Cool. Let's check up top. 6, 5, 4, 3. Head down, please. I know. 2. Yes, I know. Head down, please. That's 2. That's 1. That's occiput. Let's bend. Let me nod the head. Right side. That thing don't move. Let me do it. Come on. That moves. That doesn't move as well. But it's starting down here. That's 2. C2, T3, coccyx, left ilium. Sit up straight. Let's check the movement of the shoulder. This one's not bad. Let's check this one. Let me do the work. Okay, so he doesn't have the smooth glide. It's got more of that ratchety feel. It's not as smooth. It's not bad, but it's not as smooth. There it is. Now I can feel it. Okay. Sit back for me, please. Now for your ankles, we said since it's an old fracture, next visit we're going to take ankle x-rays. We'll deal with the ankle then, okay? We have enough to deal with today. I'm just checking. Slowly open your mouth. Open, open. Right side comes out. Keep going. Open. So this is a right AI. Slowly close. Little compensation on the left, but this is a right AI major. Alright, let's make a game plan. He wanted to be here, right? He told you. Okay. Alright, so coccyx is like the guitar that we tune, is tuning the whole spinal cord. Coccyx, left hip, T3.
Mhm.
Then I'm going to have you walk. Then we're going to check up top and see what changed. Fair enough? Okay. All right. Let's get started. Can I have you walk it off once while I look at the x-ray one more time and figure out how I'm going to set you? You can walk one more time for me, please. And let me figure out how I'm going to set. Just loosen up. Get ready for me. So the coccyx is up high on the right. So I want to bring it from right to left and back up to S5. I'm going to bring it up this way. So we're going to bring it this way. We're going to go right side down. Lay on your right side over here, please. I got to be down here, sir. I'm going to bring the shorts down, but I'm going to be on your underwear.
Okay.
Okay?
Yep.
And I do it this way, so we're going to bring this up that way. Okay. Let it roll forward. Come forward, please. I got you the whole way. I need you to let me have it.
Okay.
Let me have it. Let it roll. Gotcha.
It's okay.
It's good, right? Not bad. Come on up. Walk it off once, please. Walk it up. Ah! Keep walking one more time. Different?
Yeah. Feel the support.
Feels what?
Support. Good.
Cool. Let's go back down. Let's go over here face down, please. I'm going to do his IN ilium here, and the reason I'm doing it here to start face down, because I set his coccyx right side down, left side up, and it's the same side up, so I don't want to be on the same side, okay, for that. Now, most people won't do this way. But I do. I'm going to be on the right side, and I'm going to set the right hand. Can you help me? Can you put your hands right here, please? Are you okay doing that? I'm going to hold on to the sides, please. Light, light, light. Just the fingers.
Just a finger.
Yeah, no thumb. Just finger.
Oh.
There you go. So IN, we want to push the IN out. Holding the right, stabilizing the EX on the left, pushing it out. Good. Just like that. Slide up a little bit, Danny. Up. Go up. There you go. A little more. There you go. Thank you. Okay, now we're going to do T3. T3, we have a PRS, slight side slip. Well, this is going to be fun. You doing okay there?
Mm-hmm.
All right. T3 side slip, we're going to start. We're going to do it in two parts. Part one, I'm going to be on the transverse just to start it, to get rid of the side slip. Let it go down.
Oh.
And now we're going to come over to this side. And we're going to get the rest of it. There you go. I know, I got you. Step away from the vehicle, sir. Hold my hand. Let's walk. Walk 3-4 times back and forth. You can tell your wife what's different.
Feel light.
Feel heavy. You're not holding your head up. I like that look on his face, like what the heck just happened? You got the Shanghai surprise. Keep walking.
Yeah.
Keep walking. Did he really want to come? Or
Yeah.
you made him come?
Oh, he really wanted to.
Okay, good. Have a seat. Now let's check up top. Move your left shoulder. See how it feels. Move it.
Oh, keep going. It's getting better. Yeah.
Now, is it going to go away in one adjustment? No, but he should already feel a difference there. Okay, relax the shoulder. Let's re-scope. They want to see the scope. T3 is clear. Good call. T9 is clear too, so whatever was going on in the mid-back is good. Sacrum is clear. Now let's check up top. No, we're not done here. Come on. Jumping the gun there. Clear. So, look left, look right. Different?
Mm-hmm.
We didn't touch up top yet. Now, let's check the jaw. Center on the chair for me, please. Look up. Slowly open. Open. Close. Different? A little different, dude. Open. No beep. So, it's different.
It's different.
Ask him. Look, it's different. Open. I'm not messing with it today.
Yeah.
We got a deep set. That was T3,
Mm-hmm.
Coccyx.
It's not gonna help.
And let me explain this Coccyx to everybody. This is my new friend here, guys. This is my new friend.
Okay.
Let me explain. So, the coccyx, or the spinal cord L ends at L1. And it becomes this string, this filament. And it ends at the coccyx. So the coccyx maintains the tone, the tension of the whole spinal cord. From here all the way to here. And by setting that, it was tilted, it's putting tension on his spinal cord. So by setting it, what happened? It released that tension. Okay? Now, another important thing people ask. Oh, but it's a fused bone. Yes, you can see it's moving, right? This is the sacrum, this is the coccyx. See? Yours was doing this. It was gone like this, forward, and up on the left. So I pushed it this way. The joint is here. I'm not adjusting this stuff. Okay? This is fused, yes, but that's not. There's a disc there. Okay? So we did this one. We did your left hip. And we're going to go more on that hip, probably on the side next visit. And we did it, this was the major though, for your whole upper T3. Make sense? Okay. Sit up straight. Now we're going to do the buff and polish. Oh, let's check one more thing. Scoot forward, please, just so we have a comparison. Scoot forward a little bit. Let's check the hip. Open and close the knees with the feet touching. Open and close. Right side only. Left side only. Different?
Mm-hmm.
Mm-hmm. And already you can start to see this is changing. That's so cool. We're going to show a side-by-side comparison of this. Sit back for me, sir. I'm going to tune up your shoulders just a little bit. Relax it down, down. There. Let me do the work, down. Yeah, it's not his shoulder. Hey, listen to your wife. I may still be doing something up there, but guess what? It's not today. Okay? The idea in the work is find the majors. I do post scope, not everyone does. I'm looking for a change. I know I always say clear, I go for the clear, but the reality is for the Gonstead doctors and students out there, the way I was taught by my mentor, either it goes down, 0, or it even goes to the opposite side. That means we've made a neurological change. That's the most important now. Just humor me, I want to see this myself. Open. That's cool, dude. Come on up. Let's check the hands. Squeeze. Don't hurt me. You're strong. Squeeze. Squeeze. A little bit on the wrist. Posterior lunate. Posterior lunate. Squeeze. We're all set for today.
Mm-hmm.
Any questions for today?
I feel light. So far, so good. And I'll bring my parents here.
Where are your parents?
They're in Hong Kong now.
Bring them down.
Yeah.
Bring them down. We'll take care of them.
They can't
I'm
rest
also
their
going to
hands.
visit after the baby.
Mhm.
Yeah. Well, they're gonna come next month for the baby.
Yeah.
So we'll take care of them, and then
Yeah.
we'll see. Okay.
Yep.
Welcome to the office.